asking me questions. Yeah, I know you, but we ain't friends. Quit asking me questions. Yeah, we in this section, but you can't get in. Quit asking me questions.
Thank you for tuning in to another episode of Please Don't Come Again.
That was energetic. I'm Sara.
I'm Bonn.
Mark Dude's over here.
And we have Drew on the couch with
True.
Winter.
Thank you for coming to the show.
You're welcome. Thanks for having me.
Yeah, for sure.
No, thank you for being here.
You're welcome.
Thank you.
Right.
I thought I covered that.
Anyways,
Appreciate you.
how's it going, y'all?
It's good. It's fun.
Good.
Another week to start.
It's pretty amazing for me. I got winter on my lap, so this is the best.
Yeah, I'm feeling pretty satisfactory myself.
After that beer you drink off the ground?
Yeah, listen, it was just a really hard day, and
Winter.
I needed a drink, and so I just,
You're slurring your speech a little bit, babe.
She trickled off on that one. Is she getting a little drunk or?
I'm just
This is
just a little sleepy. I don't think I'm drunk yet.
Winter's first drunk episode.
Welcome to the club, Winter.
I know. Time to go to level.
How's today was Bond's Monday.
Today's
Was
my
it a rough
Monday.
day?
Yeah, Mondays always suck.
Case of the Mondays.
Yeah, you know.
It's actually Tuesday, but it's Bond's Monday.
Yeah, it's my Monday. Off Sunday, Monday. No, it's okay. Just, getting back at it.
Mm-hmm.
After I think it's a relatively uneventful weekend. Mother's Day was wet. Oh,
I was not like that.
Cut that out.
Yeah, right.
yeah.
So what you meant by that was that it was raining.
Yeah. It was raining on
And
Mother's
snowy.
Day. The weather was raining on Mother's Day.
Thank God we're in Collinwood, man. The further away from the lake you got, it was snowy.
Yeah.
My parents were in South Euclid. They got snow.
That's where my
Yeah.
grandma.
I'm doxing my
grandma
parents
lives
right now.
in Lyndhurst, South Euclid.
Your grandmother lives in South Euclid.
Thank you.
Timeline for the listeners: May snow.
Oh yeah.
Oh, yeah.
May snow.
I forget that
Oh, we said Mother's Day.
people aren't here.
Well, every year it's in May.
Is it?
Yeah.
Is it?
Yeah.
For a while, I didn't
Well,
know that.
seriously, dude, it is.
For a long time, I didn't realize that St. Patrick's Day was on the same exact day every year.
I don't know.
You're like, how is it on a Tuesday this year?
Like
What happened?
until high school, I didn't
Way to be.
realize.
I don't remember any holiday besides like Christmas.
An easy one.
And my birthday.
How about
So
Halloween?
Sarah-
It's
You
not
got
a
that?
holiday.
So Sarah, until you were drinking on St. Patrick's Day, that's when you realized.
Precisely.
Yeah.
Yeah. When it mattered, and I cared when St.
a little
Patrick's Day was.
a little unknown fact about the castmates here. The first time I ever texted Sarah was on St. Patrick's Day.
Oh yeah.
What'd you say?
That's okay.
Do you want to? I'll tell them.
Tell us, Sarah. Tell us.
Well, I think I texted you first.
Oh, did you?
Wow.
And I thought that he had given me a fake number because up until then we had been
13 years later, up until
up
now.
until now we had just been messaging back and forth on MySpace. So
Nice.
no. And then he gave me his number and I thought it was fake, so I texted him and I was like, "Hey, what's up?" And he was like, "Who's this?" And I told him, "Guess who?" And he said, "Slut, bitch, veggie hoe," because I've
Yeah.
been a vegetarian for a long time.
I've always been a wordsmith.
So he really swept me off my feet with that one.
Wow.
Dude,
And we
Locked it
texted
in.
for like 3 days straight.
I'm taking notes.
Tell you what.
I'm going to meet my missus.
That's how you meet the good ones, is pretend that they...
So Red
Or
Headphone
shit.
guy was a
Yeah.
lot closer than we thought.
yeah, exactly. Just talk to me like shit, and then
Yeah.
I'll be head over heels for you.
Tell you what.
Just kidding. Don't do that to women or anyone. So, moving on.
Yeah.
Yeah. So
This
anyways.
has been slightly embarrassing. We have Drew here with us today. I know Bon asked you this. Do you prefer Drew or Andrew?
I don't care as long as it's not Andy. If you call me Andy, I'm usually like, hey, man, I'm not a cowboy.
Cool. So
Does that bring you
yeah.
back to like Toy Story?
I don't know. It may be subconsciously. I really like Toy Story.
Does that happen often?
Me too.
Do you call you Andy?
A couple bosses have called me Andy, and like I didn't feel comfortable correcting them, so I was like, I guess I'm Andy. Now. You know, I was just like, I guess I'm just something I'm very uncomfortable with.
Why would they go straight to Andy and not just call you Andrew?
I don't know. I think it's honestly a power move. You know, it's just like, hey, I'm your boss.
Yeah.
I call you what I want.
Kind
And
of
I'm
like
like-
Bobby
What if they just called you
or
and?
Joey.
Just what?
And.
Yeah. Or like, what if they just like kept me in the present tense? They're like, what's up, draw?
What's up, Drew? A Drew. That's what I like.
Adrew?
Adrian.
Okay. You can call me whatever you want.
Adrian.
So Andy, you're a massage therapist.
Yeah.
I don't know if we haven't really mentioned like where we work or like where we have previously worked by name. I don't know what your comfortability is with that.
So I worked at Massage Envy.
There you go.
I don't work there anymore. I found my way out of there after 3 years. My first 3 years, I was a massage therapist at what is quintessentially known among massage therapists as like a stepping stone. Like very much like, hey, this is the McDonald's of massage. Like this is where you start out. Because it's like you can get a really good quality massage therapist there, but if you get one, they typically, because of the way that Massage Envy works, like you sign on to like a membership program and everything as a customer, and it's a 12-year contract that you're signing. Like
12 years?
I'm sorry, 12 month.
Oh
I'm sorry.
my
Yeah.
God.
1 year.
I
1
was
year.
like,
Yeah. 1 year.
What?
Sorry. 1 year. 1 year contract. Yeah, right. 12 years. Like you're just
Oh
locked
my
in.
God. Dude, Sarah and I jumped at the idea of anything lasting 12 years.
Peach
Yeah.
on
This
that
is why
one.
I don't have a phone contract. Commitment
Right.
like that scares. How
Nah.
am I married? I don't. I'm like that is.
It's because you didn't.
It's because of my silver tongue.
No, it's because there were no numbers in the contract. You're just like, yeah, it could be, anywhere
Right.
between 1 to 15.
I mean,
Yeah, I guess
one of us might die pretty early.
I hope not. I love you both.
no.
No, but so it's a 12 month. Sorry, everybody. Sorry, Massage Envy, if you're listening. 12-month contract that you, as a customer, usually outlive your massage therapist, like because there's just a high turnover because it's an entry level position, and by the time that like I am looking for more gainful employment, you find somewhere else, and you find somewhere that is a little bit more consistent. And I mean, I don't know. I feel like I'm bashing Massage Envy right now, but I'm not trying to. Like I was there for 3 years and I loved it. I left because I didn't have anywhere to go in the company anymore. And I mean, it was great for me while I was there and it served me well. But yeah, that was definitely more service industry as opposed to what I do now, working at like a major hospital where it's much more like, hey, this is more medical. You're working on somebody who a neurologist, sent you this person and was like, hey, this person has referred sensation and I know that you do neuromuscular work, or, I know that you do myofascial work, and you can kind of like it's much more based around like dealing with pathology and dealing with like
You're not getting tipped anymore?
I'm not getting tipped anymore, which is great.
Damn.
No, it's awesome. Are you kidding
really?
me? But yeah, they pay me now. Like, they're just like, yeah, you are worth this hourly, and I'm like, sweet.
Works out better.
Yeah, in my opinion. But I'm sure that like people who do have the tipped like may never want to go away from that because it's something that they're like, oh well, I know that this person gives me a huge tip every time I work there. A lot of people kind of are worried like in terms of like the reason why we can't accept tips, now being a hospital. She's snoring so loud. Love it. The reason why we can't accept tips as the hospital is because we are in a medical facility, right? So we are like you can't tip a doctor because they're like, oh well, I'm gonna treat them better. I'm gonna give them better treatment because they are tipping me. Like that's something that has been done away with at medical practice permanently.
That
So-
feels gross to
Yeah.
even think about
Right.
like
Yeah.
tipping a doctor.
Yeah, so because I work in that field at that location, they're like, yeah, you're the same thing. Like you can't accept tips, which is awesome for me because I get paid hourly. So,
Right.
Is your clientele at the hospital ever in like such bad shape where you have to be like careful not to hurt him?
Oh, absolutely. Yeah. The interview process for getting into a hospital was intense, I would say. And it was much more based around like dealing with like, all right, what is this pathology like? What would you do if you had someone who came in with this? Whether that's and I had to show credentials that I got extra training in like oncology, massage, prenatal massage, all those things, just so that I could say like, hey, like I'm comfortable working on this this demographic, essentially. Yeah.
Winter's snoring in the background of
great.
all the episodes.
Great.
Yeah, she is.
She got drunk and passed out.
She really did. So I'm guessing like the people you're working with at the hospital are of a different I want to say like different breed than those clients at Massage Envy. Is that
Are they in
accurate?
worse shape? Is that fair to say?
I would say that. So okay, when I was at Massage Envy and working on clients, so immediately there was a difference, right? At Massage Envy, I'm working on clients. At the hospital I work at now, it's patients. Okay, so
you gotta have patience.
yeah,
Oh,
right. You gotta
boy.
have patience with those patients, baby. That's how you help them.
Couldn't-
It was great.
I can't miss those.
I'm
It was
about
terrible.
That was so good.
So I guess what I would say, like, the big change for me has been going from like, at Massage Envy, it was more like, all right, you have 2 or 3 people out of 8 massages today that are coming in with this specific problem that they need addressed, right? Now at the hospital, it's like I might have one patient that's like, yeah, I'm just trying to relax, man. They're not coming to me to relax. They're coming to me for like, hey, I can't move my shoulder in this direction and I want that range of motion again.
Right.
So in my opinion, much more rewarding work, because
Yeah.
like I have people who come in with like, something like frozen shoulder or something where they're like, I can't wash my hair. And then they like, it's the coolest thing when I get something like that and they come in and I work on them and they're like, I'm like, yeah, now that we're done, show me your range of motion. Like, show me where you can reach. And they just go like, oh, this is amazing. I can reach above my head. And I'm like, sweet,
I can
cool.
shower for the first time in months.
right. But no, I mean, that's where like the coolest part of being a massage therapist is like getting that quality of life improvement that people don't realize and like start to take for granted that like, oh, I can always do this. And then, you can't. And you're like, man, I can't do this thing that I always did before. And then they get a massage and they're like, oh my gosh, like this is amazing. And it's not even something that it's like, all right, you got to come back in 2 weeks or you got to come back in a month. Like, as long as you don't create that repetitive motion that put you in that same position, like that same spot where you had this chronic injury, like if you're just conscientious about it and take the time to say like, okay, I know like where I need to be now and like I know what messed me up, like you can completely avoid getting back to that point,
So massage, it's essentially like a muscle reset.
Kind of. Yeah, I could see that. We're kind of looking at like kind of a static release of some of the like what people call knots, trigger points and like hypertonic muscles versus hypotonic, which is like if you're always working in front of yourself, like on a computer, like at an office, or if you're like me, a massage therapist, and your arms are always in front of you, or even like the mechanic you guys had on, or like any of these people who are constantly in front of themselves, like our eyes are in front of our face, so we're constantly working in front of
That's what
ourselves.
you think.
Yeah, right. Obviously, I haven't met my mom, but like always working in front of ourselves and everything, and like reaching down, and we look down at our phones or at a laptop screen for everybody working at home. That's been something really big. Like you're constantly putting yourself in this position of overextension in your back, like everything's reaching forward, and then your pectorals, conversely, like everything in your chest and everything is reaching in front of yourself and shortening itself. So what happens is you retain your strength in the front, but you lose your range of motion. Like you can't reach behind you. And then like your back muscles are overstretched the entire time. So that's That's your hypotonic. Hypo means less, like hypo meaning less, hyper meaning over. So if you're looking at hypertonic, it's like over flexed versus like less flexed, I guess, essentially, is like how you would break those down. So hypotonic, like the muscles in your upper back are like constantly reaching forward, so they retain their flexibility. But you notice that like if somebody puts any amount of pressure against you as you're trying to like flex those muscles, you can't. You lose all your strength. So
I feel like my back started to hurt while you were explaining all this.
I think that's actually a lot of massage is like just building awareness too. And just telling, like, people are like, oh, you know, like, I didn't even realize that part hurt. It's like, yeah, because no one stuck an elbow in it. You know?
Yeah.
Oh, damn.
I kind of feel like yoga has a similar tendency, for me at least, to, like, I practice somewhat regularly, and there will be times when I'm practicing and I'm like, holy shit, I didn't realize, like, my spine was, you know, in need of all this twisting and turning. Like, I didn't realize how stiff I was. I didn't realize how, like, my lower back was so tight or whatever. So that's really interesting. Do they ever, like, coincide like that? Like,
no, 100%.
Yeah.
Like when you're everything you're saying about yoga, I'm like, yes, go. Like, yes,
yes,
that's
bitch.
it. Yeah, go off. Yeah, no, I can't agree more. Like anything that brings awareness to your muscles, I love. And yoga is definitely one of them for me. I remember like one of my first yoga classes, them talking about like, oh, focus on like being this muscle group. And I think that it probably wouldn't have landed for a lot of people, but like as a massage therapist, like anatomically, I think like, yeah, it's exactly this one. And they were like, notice if there's any tension there. I was like, oh my God, there is tension there, you know? And they were like, you focus on being that muscle group and releasing. And I was like, okay, I'll try, you know, and it worked.
Try my best.
It was great. And it was because I was able to like a lot of people like think of that as like, oh, that's just like, you know, it's placebo, but it's like, no, dude, I just like focused on the muscle group, thought about what it was, brought awareness to myself and focused on that spot and was like, all right, I'm going to like try to release that area and not hold so much tension there and hold it somewhere else or let it go, you know?
Yeah.
And,
I think it's more about, too, like, finding the perfect, like, spot where you're like, oh, I got it right there. I'm going to lay into this, where it's pulling on those muscles, stretching it, you know?
Yeah, you can be, like, in pain, but not really know where it's come. Like, that happens to me all the time. And I even went to my doctor kind of recently. I had fucked up my back at the gym. And I thought that I was, like, super weak on the one side. I have always had these problems, like, lifting weights and, like, doing deadlifts mostly, where and, like, squats and stuff, mostly leg stuff and balancing stuff, but I thought my one leg was, like, way weaker than the other. And it turned out, like, it's just my hip, the opposite hip, that is, like, all jacked up because one leg is longer than the other, and my posture and my stance has been fucking it up all these years. And I'm like, cool.
Right? Yeah.
So what did they do for that?
Well, my doctor, like, she calls it a quote unquote manipulation. So she basically like whips me around a little bit. And
Is she a DO? Is she a osteopathic physician?
I don't know.
I bet you she is. That's awesome. That's great.
She's really cool. She's
Yeah.
done it for my neck before. I went in because my neck was hurting a little, and she was like, "It feels like you were in a car accident." I was like, "Oh no, that's just where I hold all my rage and anxiety."
No. I work in a coffee shop.
Yeah. So she just like tossed my head around, and then it was like a few minutes passed, and I was like, "Oh my God, like this is amazing." So I feel like, I don't know. That's pretty cool.
What is I'm just gonna go way far back here. What is the exact definition of massage therapy?
Soft tissue manipulation.
Soft tissue manipulation? Okay.
Yeah.
Okay.
So
I guess I never really understood like where it actually dealt with on your body specifically.
Yeah, so I mean, we can deal with the connective tissue, which is the fascia, but that's like extra training for myofascial techniques, which is the fascia is like a sheath that goes over all of the muscles, and it's like a muscle. It's the connective tissue for your muscles, which is like interestingly enough where all of your scar tissue is. So like and scar tissue doesn't necessarily mean like, oh, I had this like crazy like trauma that happened in this area. It could be like, yo, I've been lifting a lot and I've been really focusing my biceps, and now there's like, because what you're doing is you're tearing, and then it's rebuilding, in that spot, and like, oh, I have this like buildup of scar tissue where that healing has been, and like the muscle's great in the sense that if you tear something like this, like where it just comes apart, it doesn't come back together in the same way. It tries to like kind of thatch roof itself, like it tries to come back stronger because it's like, oh, well, we had a tear here, so we want to make sure that it comes back stronger. But it almost does that in...
what doesn't kill you makes you stronger.
Right. Yeah, it's true. It almost...
Is it?
Kelly Clarkson says so.
Yeah.
Kelly
Dude, isn't
Clarkson?
Isn't that who it is? What does
I don't think so. Is that
I don't
Kelly
know,
Clarkson?
Mark. Why don't you sing it for us?
Yeah,
and we'll
seriously.
see if we remember.
I don't know who it is.
Do it.
I just did it, dude. You missed
Yeah.
it. I did
Do
it.
it
Take it
again.
from the top.
No, it's.
Okay.
No,
I don't really know how it goes very well.
I feel like I know what you're talking about.
No, but so it comes back together like that, stronger, which is great, but it does that almost in spite of everything around it. It's not thinking like, oh, well, we have a nerve bundle here that we need to work around. It's thinking like, okay, we need to be stronger in this area, so you might get compression of a nerve or something. And then now we have...
What are you giggling about over there?
I was just like thinking like, oh, this is like me in a customer service scenario, just like learning how to cope and deal with people
Yeah.
like over and over again.
Ooh, my nerve
The
bundles
scar
are collecting.
tissues, the scar tissues of my heart
Oh, no.
and my soul.
Are we going to Papa Roach this now? Go into scars?
I was
Whoa. Which version did you listen to?
yeah, that was the
Yeah.
Papa Roach.
Papa Roach
So
needs
now
to-
that we
needs
just
a
finished our
massage.
like 25-minute lecture on massage, what are you guys feeling?
Papa Roach.
I feel, first off, I feel like my back hurts.
What? So, I am someone who doesn't like enjoy people like touching them
Me
like,
neither.
a lot.
So sorry for all the interactions I've ever had with both of you, where I'm just like, hey, it's great to see you, and you're like, stop, get away.
If he's drinking, he's
yeah,
he
fun.
loves.
Okay,
to,
first of all,
He loves taking
he
selfies.
loves
first of
affection,
all.
loves to be
I have
touching
so many
his
selfies
buddies.
with Bond.
I can
it's
tell
the
how
selfies.
drunk he is by how many selfies he's been taking. And like how he'll
He's
be
getting
like,
upset.
Joe, how long have we known each other since 6th grade?
He gets
That's how I know how
nostalgic.
Bond's
I love you,
gone.
man. Do
Yeah.
you want some food?
6th grade,
You want me to
man.
make you
Joe
some
and I did do
food?
that.
Sixth
Joe and I
grade.
do that every single time.
Every
He's like, do you want me to make
Goddamn
you some
time.
food? Where you're like, dude, we're at the Fillmore. You can't, there's no kitchen.
Joe, DoorDash Taco Bell. He does
He
that
does.
every time.
He does.
Dude, what
And
a
then he
move.
doesn't tell anyone and he orders it and then I have to steal his burritos.
Only for himself?
Yes.
Dude,
What a
that's
man.
so shady.
Yeah.
Joe, if you're
Ramsey.
listening, stop doing that. It's like a rule you have to fucking tell
It's
everyone in the
okay.
room.
I took his burrito the last time he did
I mean,
it.
I've had this scenario play out, but the opposite.
I feel like we're
the
doxing Joe
person
right now.
tells you, "Hey, I'm ordering Taco Bell. Does anybody want to throw in Venmo me right now?" And it's
Yeah.
like, "Fuck yeah, let me get your phone. I'll order." That's shade.
Joe?
Mark, I'll always buy you Taco Bell. Just know
Hell
that.
yeah. Thank you, dog.
Joe's birthday's coming up.
I know.
Should we all get Taco Bell, but none for him? Just invite him over. We're all
show up
eating
at-
Taco Bell.
Let's have it delivered to his house and then go pick it up and
Yeah,
take it
right.
away from him.
I don't know Joe on this level. Like, I think Joe's swell.
He's all right.
He's fine.
I'm just kidding. I love
I've
Joe.
known him since
Can't
6th
let-
grade. In case you
can't
His
can't
mother
really let go of the
married
TV
us.
Yeah, I
thing.
can tell.
His
dude.
mother did marry us, and Joe's mother is like my top 5 favorite
She's an
people on the
angel.
planet.
I can definitely tell you know Joe since 6th grade, since you knew his birthday. You were just like, yo, I think it's like coming up.
No, it's coming up.
Yeah,
I
I
just
wanna-
told the whole world what his parents' garage code was. Well,
Did
no,
you?
if you don't know how old Joe is, you don't
Yeah.
I'll cut it.
know it. Okay.
The code got cut. That's why it just cut out.
I'm telling you, dude, we're just here to dox people. Like,
I know.
I just want to slip this in. I don't want to pull a Bond and be too late because I know we're like, behind a couple episodes. My birthday is coming up. And if anybody wants to tell me happy birthday,
Nobody
it's coming up
cares.
early June.
Early June.
Give me a happy birthday.
Early June.
The big
and-
3-1.
And Heinen's for the win.
Okay.
Back it up with that.
Mark, I got you a plant. What more do you want from me?
jeez.
I don't need it from you. I'm just saying, random customers at the coffee shop have come up to me and been like, "Hey, I listened to the pod and I'm for Heinen's," and I'm like, "Dude, hell yes, thank you for saying that."
And then they go to Bond's work and they're like, "I'm all about Costco," and they're just like trying to get discounts.
No,
all
we'll
about
engage
Heinen's.
and we'll
wanna see
talk
the
about
papers?
Heinen's after that. We'll engage in Heinen's talk. It's good. Good for the world.
Moving on. Forever.
All right, so
would you say
I'm
that
Aldi's over here for what
that's
it's worth.
what I
we
said.
are.
We're all
so
Aldi's.
look,
We're
so
all pro
we're
Mark
all
said I
Aldi.
wasn't allowed to choose Aldi.
We're all
Yes,
Aldi.
you are.
Mark.
Aldi
It's
is
not
like,
what the debate
is the
was.
winner of all of our hearts.
I don't want you guys to act like I didn't listen to any of those. Like I was 100% listening. I was like, but Sarah said Aldi.
No, Aldi's my favorite. You know what my least favorite is?
Dave's.
Save a Lot.
Oh yeah, that's what I said too.
Is that even a grocery store?
Dude,
Dude.
Rose and David said they tried to go to Save a Lot on their way here yesterday,
thinking of
and I
Big
was
Lots.
like, "Why would you do that to yourself?"
Dude, that sucks.
They're like, we got
I don't think
Yeah,
I've ever
we
shopped
got
there.
so many
I
canned
don't-
goods because
I
that's
don't
all
really
we
know
felt
what it
comfortable
is.
buying.
It's the
and
weirdest.
like some crazy
store-
ass looking meat. They have the weirdest.
They have the
looking
weirdest looking meat, dude. It's like
They
colored.
do
It's like
have,
dyed
though.
meat.
meat. Those
Ew.
little cups of ice cream with the wooden spoon thingies. They have those,
Party.
so that's pretty legit.
I don't know. I never find myself inside of a Save a Lot.
I haven't gone in years.
I've never. I don't
Dave's
think
is
I've
my
ever
second
been.
favorite.
Yeah, I'm not a fan of Dave's,
I'm not a fan of Dave's.
Me neither.
which is rough because
It's so expensive for no reason.
yeah.
Yeah.
Well,
No
through
reason.
all of quarantine, when they were remodeling the Aldi's by my house over in Euclid, over in the area that I live, I was going to Dave's because it's right next door, and I was just every time I was buying produce, I was like, I was just so upset.
This is bullshit.
Yeah,
You know what's a solid underdog? Is Late Night Giant Eagle.
Yeah.
Late Night Giant Eagle's great.
Late
Yeah.
Night Giant Eagle's an underdog.
Much like Target,
Used to
I
be
like
open
to get
24/7.
stoned
Some
and
of
go
them.
to
Still is some
Giant
of them,
Eagle
yeah.
and listen to my
The Willoughby
podcast
one's
while
not
I shop.
anymore.
That's lit.
The Willoughby one.
It used to be 24/7. I popped in there the other day.
Oh man,
Didn't even know it was about to close. Announcement came on.
they're like, you gotta get out.
At Willoughby?
Yeah, I know.
Oh, no.
I sent Vaughn a picture of Depends.
They,
Oh yeah.
I was like, "Yo, dog, you want me to pick these up? They're on sale."
I thought those were underwear, and I was like, "What? What?"
They stopped that for
Straight
quarantine
up Depends.
or for COVID.
oh, did they?
Yeah,
So they'll be coming back then.
maybe.
Hopefully.
Someday.
Okay, question.
Y'all think
Yes.
COVID's gonna be done?
Be quiet.
Getting back on track here.
Get back on track, Maria.
Okay, first of all, I had a question initially, but
I guess we can talk about massage again. Go ahead.
I was going to ask,
think
did
you
you
said-
ever like lose work during COVID?
So luckily, no, for me. A lot of my ex-coworkers did.
At Massage Envy?
Yeah. Well, okay, so all of massage was shut down by the State Board of Ohio. They said that that until we, deal with some precautions and like figure out how we're gonna do stuff, like there's no massages. So from I want to say it was late April, or no, it was late March through early May. So just like a year ago, we weren't allowed to massage at all. That being said, at the hospital, I was able to teach Zoom classes. So I lost some hours, but I didn't lose employment. Like they kept me.
Wait, what were you teaching?
I was teaching self-massage classes. So like,
Whoa.
hey, here's where you have issues with your upper neck or your upper back. Not upper neck. There's no lower neck. It's just the neck. Talking about like, hey, like this is where you're carrying tension. Like these are ways that you can alleviate it yourself. And it was honestly a lot of like techniques that I give my patients as homework. Like, hey, like if you start feeling this tension build up again, like you don't need, and maybe this is to my detriment, but like you don't need an hour session for me to like fix something that you could just stretch for a little bit and get some relief. Like try this stretch out, and like stretching is kind of out of our scope of practice. We have to kind of lean into it as though like, hey, this is what worked for me in the past. It might help you. When like we know all the muscles and bones in the body and everything, and we're like, hey, this works. So if you ever get a soft recommendation from a massage therapist, listen to it because they know what they're talking about. But the rules are kind of unclear about like our licensure, like what's in our scope for stretching or not. Because depending on what school you go to, people are like, you can do that, and other schools are like, don't do that, and everybody just comes into the field like, so like, what do we do? You know. But
You just gotta go by like where your employment is and what they say.
yeah, kind of. I know that like that's been the wild thing about working at the hospital, working directly underneath a physician, is been something where like I'm working on people that at other places, not just Massage Envy, like a lot of other places, any spa, any of those like more relaxation based places, I would be turning them away. I'd be like, yeah, you need a doctor's note or something before I can even start working on you. But like that doctor is now in my office and I'm like, hey, this is what's going on. This is what I'm thinking. Is there anything that you would recommend me avoid or me not do? And they're like, yeah, don't do this according to this. This is contraindicated, you know, stuff like that. So it's been awesome being at the hospital, honestly.
Nice.
Yeah.
So first question, I have 2 questions.
Okay.
I want to ask before I forget.
I think I can handle that.
So self massage is something you've like taught people how to do before. But had you ever had to do it virtually before COVID?
No.
Was that like a big...
Yeah, that was gnarly, man.
Okay.
Because it would be like, first of all, like I wanted to make it accessible to everybody, and like I didn't want it to be like, all right, well you're tuning into neck and shoulders this week, so make sure you stop on by, and then like the next one I'm
to
like,
do the voiceover.
yeah, right, and then like the next one like, oh check out, we're gonna do arms today, you know, like I wanted to make it like specific to whoever was in there. So whenever people jumped on, I was like, you know, just throw in the chat box, because it was all on Zoom. I was like, just throw in the chat box like what you want me to work on, you know, like what you want me to show. And it is so funny because people would be like, neck, give me neck, I need neck, let's do neck, like every time, no doubt. Everyone's like, please, you know.
Is neck like a major muscle?
Yeah. Oh.
Like is neck a major muscle problem like in the field?
Well,
Yeah, for
probably
sure.
especially during COVID with
Yeah.
everyone like
Everyone's
working
starting
from
to work
home.
from home. Yeah, exactly.
Is neck a muscle?
Yeah.
Does the self massage require like a massage tool or
Nothing
or
that
you
I
just
taught
stretch
requires
Just
it?
your bare
Yeah.
hands.
What do you feel about
Okay.
massage tools? Do they work?
So massage tools obviously come from a place of science of like, hey, like ideally like this works, but I will say that like the Theragun and the Hypervolt, like all those like
Those are the
the percussive
Yeah, those are sick.
massagers that the like, oh, it's
Like
just
the
an electronic-
AK-47 ones?
Yeah, it's terrifying, man. It's just
Yeah.
like there's so many settings on it, and it's like
That goes-
honestly, like as far as I'm concerned, as a massage therapist, the only ones I would ever use, unless you're like a professional athlete, is like low and maybe medium, you know.
Yeah.
And like they'll be like low, medium, high, extra high, and it's like nobody needs this. And like
I'm specifically talking about the chairs at the mall.
yeah,
Do those work?
Yes, I mean like
And why do they insist on going up your butthole?
Yeah.
I'll
That's a
tell you
good
what.
question.
that's
Why
a cool-
is that necessary?
Let me tell you the super cool thing about human massage therapists. Very rarely do they go up your butthole.
Oh, thank God.
Yeah.
I've been
You said
afraid to go
rarely,
to a
though.
massage
Yeah.
therapist this whole time because of that.
Wait, they're not supposed to do that?
Yeah.
Come on,
actually,
man.
ugh. One, my old boss has a massage chair, really nice.
Yeah.
Massage chair, and I was using it one day, and I got trapped in the massage chair.
You couldn't get out.
It got both my arms were locked out. And both my, because it goes around your arms, and it goes around,
I know.
it goes around your thighs, and goes around your calves.
Are you sure this was a massage?
Yeah, right.
No, listen.
Just like straps you in.
So, because it
This
massages your
wasn't
neck
like a
and your
mental
head, right?
hospital.
Holy
stuck,
shit.
I'm stuck in this chair, right? Both my arms are locked down because I'm massaging my forearms and stuff. My thighs and my my calves are all locked in, right?
Nice, dude.
And then the feet portion, like as I'm already locked in, the feet portion comes up. And it locks your feet in it, and then it massages the bottom of your foot, but it starts tickling my feet.
God.
And
That is my worst nightmare.
Is this at the mall?
No, it's at my boss's house.
Oh.
And I'm freaking out. I'm like stuck in his chair and it's tickling my feet. And I'm like screaming, like, get me out of this chair.
Does he have a camera pointed at it too? He's just like,
I was gyrating super hard, like trying to get myself out of it.
Oh, to be a fly on the wall.
Right.
Oh my god, that was terrible, dude.
Amazing.
It was the most vulnerable I've ever felt in my life. That was with a robot.
How did you feel afterwards?
What's that?
How did you feel afterwards? Did it?
Awful. I never went.
more tense. Like,
Yeah.
Break down. Are you kidding me?
I don't like being tickled.
so you really just
Strain
want
your back trying to thrash out of it.
you really just wanted
Got
me to tell you,
whiplash.
like, no, they don't work. Because in your personal experience, it absolutely did not work.
My personal experience has scarred me for life.
Oh shit, that was a good one.
That's a good story, dude.
Thanks, man. Thanks. That was a good one. Yeah. But anyways, so
Sorry about your trauma.
I mean, you know, if you got a chair, just,
That sounds like the most hardcore massage chair I've ever heard
Right.
of.
no, this massage chair is sick. I mean,
It sounds kinda cool.
Like as soon as you sit down, you're like, oh wait, I didn't go to the
I'm sure if
bathroom.
you knew how to
It's, like,
work
too
it
late.
too, you could probably
got your
choose
feet
to not
locked.
do the foot part.
dude, the thing was like, I don't know, it was like $8,000. It was like insane. It was like extreme chair.
Sounds like something you would
Sounds like it.
buy in The Sims.
I don't know. I never played Sims.
Me neither.
No, I did.
Oh dang!
I played Sims for like a little bit, but I would just murder the family.
I didn't understand how
over
to do
and
it.
over and over. I would just murder
Use a
this
cheat
family.
code and build a mansion.
I didn't.
I played
Mark,
real
I don't
video
know
games.
Anything.
I played real video games like Coaster Tycoon,
Oh, I played that right alongside.
Roller
I
Toaster.
love Roller Coaster Tycoon.
Roller toaster.
Yeah.
No, roller coaster. I was just
Ball in the shoulder.
A slip of the tongue.
Yeah.
Yeah. But so in your many years as a massage therapist,
6 years now. I just hit that.
Wow.
Isn't that sweet?
6 years
Yeah,
today.
isn't that
6
wild?
years
Today?
left, and
Is
you're
today
out of
your
that
6 years?
contract.
No, like earlier. It was last week actually.
Oh well,
Yeah.
that's still pretty close. Congratulations
Yeah,
on 6
congrats.
years.
Thanks, guys. Thank you.
In those 6 years, what are some of your lows and what are some of your highs?
Some of my lows and highs.
Yeah. We want the dirt.
Yeah. Okay, I'm gonna tell.
What's the worst thing that ever happened?
Okay, so I had a man definitely come on to me during a session physically, not like proposition me, like, which was so funny because like not funny, but as a massage therapist male going through schooling, like every time we talked about ethics, it felt like, all right, ladies, listen up. This is super important for you guys. Guys, just, stick around, but like this is for the ladies. Like we
Right.
need to talk to them. And like within my first week of being a licensed massage therapist, I'm working, and this woman
Within the first week?
within the first week of me being a massage
Were
therapist.
you like, dude, this is...
Yeah, I was like, whoa. Yeah, so I was working on this woman, and I was working on her calves, and I said, is this pressure okay? And she said, are you seeing anyone right now? And I was like, what? I really didn't know how to react because like the entire time I was told this wasn't going to happen to me, or at least that's how it felt being a student. And it was just like, oh my God, like I have to deal with these situations. So then it very much became like I ended up becoming the trainer and like teaching all the new hires like what to do and like how to deal with inappropriate conduct, like how to get through that as a massage therapist, which was like basically focused around like make sure that you offer consequences for actions. Like if you continue this, I will have to stop the session, like because any amount of allowing, whether you're just ignoring it or whatever, like by not addressing it, you're giving permission, and you're at the very least, like aside from yourself, you're putting other practitioners at risk, and that's like the worst thing ever, So yeah, I was working on this guy, and
Wait, what happened with the lady? How did you diffuse that?
I was like, yes, I am, and she was like, oh, and it stopped there.
Okay.
Yeah, that wasn't the scary one. I'm in the scary one. I'm telling you that one.
Well, just wanted to
Yeah.
get the end of that.
No, I'm sorry. We need more resolution. So I'm working on this guy, and he is very, very upfront about his sexuality and everything, and like who he is, and is obviously, he told me about his partner and everything that he had, and he was definitely gay, and that's awesome. Like, go you. I was very excited about his partner and his family life that he was telling me about. And as I was working on him, like as a massage therapist, incidental contact happens, right? Like I'll walk around somebody and I'll bump into an arm or I'll bump into a foot or something. And I noticed at one point, I was like, man, this is happening a lot with this guy. Like I just keep bumping into him. I was like, this is wild. I need to pay more attention. And I had him roll over, like flip over so he could be face down so I could work on his back. And he kind of brought his arms out and like grazed my thigh, but like very individually with each finger.
Oh.
And I took a step back and he said, well, I didn't want you to move. And I was like that was definitely like I froze in that moment, you know, because I was like, oh my God, like this guy's looking for more than just muscle relief here, you know. This is what I do. And it was terrifying. And honestly, like what I thought was like if I don't say something like and he goes to someone else because I'm not like doing what he wants or whatever, like I'm putting one of my coworkers at risk for this to happen. And I said, you know, sir, I'm not sure what you're looking for in this session, but this is a professional massage therapy session, and what we're doing is strictly therapeutic, and I'm not here to do anything else. And I said, if you're okay, I'll continue the session, but if you continue this behavior, I will end the session. Very matter-of-factually, and like made like, okay, this is what's going to happen if this keeps going, and like, but also I'm cool with letting this like this is water on the bridge if you just don't bring it up again, and you know, like I will continue working on you in this moment. But he never came to me again. And
what happened to the rest of the session? Was it fine?
He was completely fine. Yeah.
Did he react to that, or was he just silent and just
He was
awkward?
completely silent. Are you kidding
How
me?
embarrassing for him.
But he didn't say sorry or anything?
No, absolutely not. You don't apologize for that stuff if you're
The rest of the time he was getting the massage,
You're
he's probably
sick
so
fuck.
tense, just like, oh, I feel weird.
Yeah. Well, it's
Or maybe he didn't feel weird. Who knows?
it's interesting because I don't know if you guys have seen like everything happening with like Deshaun Watson right now, the quarterback for the Texans. He so he requested a trade. He like hates it there and everything. And then 21
Battery just died on your light.
That's all right. As I'm talking about Deshaun Watson, 21 sexual assault
Yeah.
cases. Yeah. But truthfully, like,
Against him?
against him,
shit.
yeah, from massage therapists and estheticians. Like it's almost like to the point where it's like a class action lawsuit because this happened to so many people. But so many people talk about how like, oh, it was just a guy going to a stranger for the first time. But I feel like that's rarely what it is. It's usually somebody that you're super familiar with, and that line keeps getting more grade for them. Yeah, I don't know. I thought that was like crazy interesting reading about this Deshaun Watson stuff, and I'm like super excited about the field of massage with it because like people spoke up, you know.
Yeah.
And I love that people are talking about it and it's happening. And there's been like a lot of they all came out anonymously. So 21 people anonymously accused him of these things, and then the defendant lawyer came back and had people who weren't anonymous say like, no, he's always been professional with me. And I thought that was the scummiest thing.
Wow.
So then
Someone got a fat check.
so, right. So then all of these people who came out anonymously, like some of them have been coming out and been like, no, I'm tying my name to this. But like, I hate that. Like, why do you have to tie your name to it for it to be taken seriously?
Right.
Like, this is
Yeah.
your profession, and that sucks.
And I feel like that happens with really any like assault cases of any kind. Like
Right. It's always, well, who
they're
are
like,
you?
yeah, well,
Yeah.
who is this person that's saying these things? Like, obviously, it's not actually like it's not a problem or it's not real if they can't come forward and
Yeah.
like identify themselves, and that's bullshit.
Yeah, absolutely. And I taught at the Cleveland Institute Medical. I taught at a school for massage therapy, and one of the things I had to go over with was ethics and like how to deal with these situations and everything. And it was terrifying just dealing with my students. who, you know, I'm younger.
They're probably throwing you questions of like specific scenarios. What if this happens?
And a lot of them weren't what ifs. Like, well, this happened to me, and I'm like, oh no, you know. And it's just
dang.
like I was as the teacher, I was the youngest person in the class.
Oh, really?
Yeah,
Wow.
100% because of all the people doing it. You know, it's a
Are you
trade
like,
school.
fuck, I haven't even like gotten to the worst parts of my career
Well,
yet.
no, because none of them were licensed massage therapists.
Oh, okay.
It was just honestly the scariest part to me was like it was just groups of women, you know,
Yeah.
who have had these experiences and you know came from all different demographics, and I was like, oh my god, like this is happening, and I need to instill this sense of like it's not your fault to these people and like call it out, you know, instead of like allow yourself to become to blame, you know, don't victim blame yourself in these situations. And it was wild, man, especially as a straight white male to be like, no, listen, you know, let me tell you. And I'm like, don't take this the wrong way, but you're going about this all wrong, you know?
Yeah.
Yeah. I'm glad to not be teaching anymore.
Yeah. Is this like, I don't know what I call it, but like assumed eroticism around massage and
Yes.
massage therapy, like a huge cloud over the industry as a whole?
Before I got into the hospital, definitely. Like when I was at more of a relaxation based, like spa setting, 100%. Like a lot of people, that was something that I had to cover in the curriculum was like how people will interpret intimate touch that way and how you know, there's a big disconnect between like people will associate this intimate touch of like, oh, this feels good to a sexualization of it. Mm-hmm. And as massage
Which is
therapists,
weird.
yeah, right. But as massage therapists, we also have to do our due diligence to like prevent that thinking and like call that out and be like, no, like this is therapeutic. I'm doing work on you that is medically based, you know? Mm-hmm. And like, there's a very scientific approach to everything massage does.
Is that something you have to be really heavy in, like with your clients or with like explaining to future clients or just people like around you that like this is a very heavily science-based practice?
Yes, 100%.
Yeah.
The amount of times that I get people asking me like, well, what are you working on now? Like what muscle? Like I'm literally in a quiz every time I'm in a massage and I'm like, I'm working the trapezius or I'm working the rhomboids here. You know, like I'm like, listen, this is the action insertion. Like, what do you want to know? You know, I know you don't know the innervation of this muscle, you know, and like
You said so many words today.
like exactly. Like this is my profession. And
Right.
you didn't go to school for this. So like just trust that I did and I know what I'm doing. And like that's fair if you want to quiz me a little bit. Like I get that. Like make sure that the person that's working on you is like legit, but it's interesting, you know.
I'm
like,
sure people want to make sure you're just as legit as, you know,
yeah, but
And
the other way around.
like thinking about it from the patient point of view or client point of view too, it probably helps to make it seem less intimate too, to hear all this medical terminology and like hear what you're actually doing and everything as well.
So, but my thing on that, like, not necessarily counter argument, but something that coincides with that is like, I'm licensed through the state of Ohio.
Yeah.
You know, so my licensure should show that I know what I'm talking about
Yeah.
and that this is therapeutic and that this is what's going on. You know, that's why like if anybody calls me a masseuse or a masseur, I'm always like, no, actually I'm a licensed massage therapist. Because masseuse masseur is like, first of all, they're French terms. If you call me a masseuse, you're misgendering me. Like I'm a male, so masseur would be the French term for massage therapist. And
Bitch.
yeah, yeah, that's how I always cap it off. And then masseuse is female, and there is no connotation of licensure with that, so or annotation of licensure with that. So it's important to identify, like, hey, I'm a licensed massage therapist, in my opinion, at least.
No, for sure.
Worked hard for those letters
You
at
have
the end of
more
my
training.
name. Yeah,
That's
you know,
basically
it's,
the difference.
yeah. I mean,
Like an actual license, like versus like people just
saying, yeah,
doing
like,
it. You know what I
Opening
mean?
just
yeah.
opening up a van.
How
with
often, how often does that
back.
does that happen?
What, people
Are-
just opening stuff?
People like not going through classes or license and just like opening things,
So
or maybe just like working at a, I don't know, some starter like
like
spa
salon
or something
spa,
like that.
yeah. So cosmetologists for a long time I actually don't know if this isn't out of their licensure anymore, but they had to learn the musculature and innervation and all that we had to do, but only of the scalp. But their licensure as a cosmetologist would allow them to give a full body massage.
Oh.
And it was always only relaxation based, but people would give full body massages all the time and just be like, yeah, I can do that. And like, as a licensed massage therapist, I'm like, no, you can't therapeutically work on somebody. You know, as soon as somebody says, hey, my shoulder's bothering me, can you focus that? That's out of your scope of practice immediately as anyone who has relaxation massage to their name. You can become like a practitioner for a very minimal amount of hours. But as a licensed massage therapist, my schooling was 950 hours of schooling with clinicals and a national board test. Well, a state board test that is the MBLEX, which is pretty much universally used nationally.
Mm-hmm. I fully understand.
Do you have another question?
No.
Oh.
Can I give a good story? I just gave that one.
No,
Yeah.
for sure. You definitely.
Yeah. So going back to like, I mean, I've had.
Wait. Pause 1 second.
Yeah.
So, like, what are some of your upsides?
Oh, well, upsides. Boy, if I had to pick one,
Yeah.
I would definitely go with.
Or better stories, whatever.
Yeah. I had this patient, going back to like talking about, you know, people with frozen shoulder and stuff who can't like reach above them and everything. Like, seriously, like, I had this patient who came to me for a massage, and it was her first time after quarantine and everything, and it was the first time she felt comfortable coming into a place to actually get massage, because, you know, working in a hospital, a lot of people weren't comfortable coming into a hospital for a massage because they're like, well, you have COVID patients, you know, like if there's one place I know where COVID is, it's there. Which is fair, but it's not like they were on the same floor as us. You know, it's not like we're like, yeah, just come to the massage. Excuse us as we walk through all this, you know, this wing of, you know.
COVID cloud.
Yeah, right, the COVID cloud. But I worked on this woman, and it was her first time coming back in probably about a year. And she was like, you know, for probably about a year and a half, I haven't been able to reach above my head and everything. And like, I've really noticed that I've lost a lot of range of motion with like reaching above my head, like washing my hair, like doing little things like that. Like I just have lost that range of motion, and just restoring that in any way would be amazing. And when she came to me, she couldn't bring her hand above like her shoulder. Like she would stop here, you know?
Wow.
And that's like far more common than you'd think. A lot of people like, a lot of people, I'm not laughing because I thought that was funny. I'm laughing because Winter just kicked me a couple times. Yeah.
She's so cute. So drunk.
It's so much more common than you think. Like, people just find ways to live without moving in a certain direction, you know? Like, think of all the people who don't go to see doctors that you can think of and just be like, yeah, I don't go to a doctor. I just haven't been able to do this for years, you know? So...
It's me.
Yeah, I know.
Yeah.
That's
Dude,
right.
I haven't seen a doctor in a minute. I work at a hospital. Like, they work with me, so I get you. But I'm talking people who are definitely like more like, hey, I'm in my 50s, and it's been since my 40s since I've been able to comfortably do this movement. You know?
Right.
So I worked on this woman. I worked in the rotator cuff and everything, which was something. This was her first time seeing me. She just kind of got the first appointment that was available, and she saw me for an appointment. She was like, wow, you know, you really focus some muscles that I've never had worked on before. And I was like, cool, that's awesome. And I just said, you know, when you come out of the room, let me know how your range of motion is and everything. Like, we'll test it when you come out. You know, take your time getting up. I'll be right outside for you. And I really focused some time, like, into the armpit and stuff, getting, like, some of the interior muscles of the rotator cuff and everything.
And when you go in, you can feel like, yo, this shit's way out of whack.
Yeah, and it's seriously like, sometimes it feels like it's a rope, you know, and you're just like, whoa. You know, yeah, it's gnarly. And then, like, to find that in someone's armpit, you're like, ooh, you know, like, so I was able to work on this woman, and she comes out of session, and I'm like, hey, you know, like, show me a range of motion. This woman who couldn't bring her hand, like, past her shoulder goes up and above her head and is like, like she's shocked, and I'm just like smiling, you know. I'm like, awesome, it worked, you know. Like I'm like, that was the right muscle, you know. And she's like, this is amazing, like thank you. And you know, she's then the next time she came in, I gave her some exercises, and this is the coolest part to me, like because I know massage therapy works,
Right.
like I've been doing it for 6 years now. I know it happens, you know, and I know what works and what doesn't. And I gave her some stretches and stuff. I said, like, hey, this is what you got to do in order to maintain this, you know, this. And, you know, of course I was like, hey, this is what worked for me. Maybe it might work for you, you know, going along with my scope and everything. But she came back and she had the same range of motion with that arm in a month without seeing me. And she said, so the thing now is, like, I have this range of motion. Like, I can come up here, like, above my head. I can raise my hand like I'm answering a question for school, but I can't reach behind myself. I can't like scratch my back or anything, and it's like hard to put on my coat sometimes. So I worked on her that day and focused like the opposite end. And after the session, same thing, like same dramatic improvement.
Oh, she can go back and
she can reach behind herself, like scratching between her shoulders. I was like, that's great, like that's awesome.
It's gotta be
like, thank you.
really, really rewarding.
Yeah, for sure. Especially for her, like she's like, finally, it's been a year since I've been able to scratch that spot, you know. Like,
A year since I wiped my ass.
well, I hope not. But
Just kidding.
no, but I
She
mean,
might
like,
have a bidet.
yeah, right.
True.
But I've seriously had patients, and even at Massage Envy, I've had clients who came in and they were like, you know, I haven't been able to, like, I had a Vietnam vet who like had PTSD and stuff, and you know, we have certain techniques to deal with like anxiety and stuff, where I can kind of like give them better sleep at night, you know. And he used to come in and see me, and he told me, I've never had a full night of sleep until I started seeing you, and it's the night that I get a massage from you.
Aww.
It's always that. So he came in monthly, and 1 month or 1 day a month, he was able to get a full night of sleep, which like after not having that since Vietnam, like that's a ton. That's huge.
Yeah.
You know, I mean, and then I've had somebody who, you know, came to me and was like one of the most obnoxious people I had, but like I worked on her, and she said, she came out of the session and said to me like, I just want you to know, like, I haven't felt this good since I got in the car accident that put me in this spot. And like when you hear that stuff, like people talk about like, oh, like this person's a bad tipper, you know, don't you know, do deep tissue or something. Like there's some of that in massage therapy where like, oh well, which is why like I love being at the hospital now where you're avoiding that. It's like, no, you just give quality work all the time because you're gonna get paid. You know?
Right.
But I mean, when I worked on that woman, I was getting tipped, and she didn't have to be the best tipper in the world. When she told me something like that, it was like, this is worth it. You know, like I'm glad I'm doing what I do.
It's like,
you know?
it seems like you're giving people part of their lives back.
Yeah,
that they lost.
Yeah, very much so with like quality of life. You know, like, oh, this person can do this activity again. You know, I had
Divine work.
Yeah, I'm just doing the Lord's work out here, dude.
just out here, you know.
Yeah.
Church of Drew.
Giving range of motion back.
Is before we head out, is there anything that you'd like to say to people about you, about your industry, about the world, about life, about your godly hands?
Don't sexualize massage therapists.
First of all, don't do that. We're not objects. Truthfully, like, just listen to your body. Listen to like pay attention to it. Like a lot of times people come into massage and they gain awareness. Just try to have that awareness before you get a massage so you can understand like, okay, this area is bothering me. Whether it's doing a yoga class like Sara brought up or whatever, like just do something that makes you listen to your body for a second and you can say, okay, this is what's bothering me and this is why, you know. That's what I would say.
Awesome.
What would you tell someone who's afraid of massages?
Are you asking this for yourself?
Asking for a friend.
Bon, just get on the table, man. Like,
The table's not gonna like hold on to you and lock you in like a chair did.
Yeah, it was a lot scarier when you got on the chair,
Yeah, man, that was a robot.
That's what I'm saying is like with
a human touch.
With a human touch, you can say like less of that, and you don't have to
Or
worry
like,
about the
let
machine.
go of my leg.
Ow.
Yeah.
Please don't tickle
God,
me.
Stop tickling my feet.
And conversely, if someone's working on your leg, don't ask them if they're seeing anybody. You know, like
Yeah, if you ever get a massage, just, you know, they're always seeing someone.
They're always,
You're always seeing
Also,
someone.
not the most appropriate time to ask.
Right.
Yeah. And pee before you get your massage.
Yeah, true.
Yeah.
You say pee?
Also,
I just kind of guessed that was a thing, but I
very
have
much
to
is.
assume that.
I would
Wait,
like
why
to
is
give
that a
some
thing?
advice.
Good advice.
Definitely wear underwear when you go.
Oh yeah, wait, is that a thing?
Because that's happened to me.
What?
I didn't wear underwear when I went to a massage, and I didn't know I was going to have to take my pants off.
I think
but-
sometimes
I
they
think
want you
massage
to
with the
take your
pants out.
underwear off, right?
Huh?
Don't you always get naked for massage?
Honestly, if somebody, until somebody tells me like, hey, I'm not wearing this, is this okay if I take my pants off? Like, I don't know until they tell me that, because of the draping we've learned in school. Like, I'm covering everything anyways.
Right.
So, yeah, I mean.
Wait, why? I missed. Why do you have to pee before a massage?
So when you do a massage, what you're doing is you're increasing circulation to areas of constriction. Okay, so like muscle groups that have a bunch of metabolic waste and a lot of stuff kind of sitting around. Like the metabolic waste is like what people always like.
Urea.
Well, yeah, but you can demystify like people who are like, oh, massage releases toxins into your blood. Like, no, it's getting all the metabolic waste where you're like it's your uric acid, all the stuff that kind of takes you to that point of like, wow, I feel soreness and I'm feeling a burning sensation. Like, you can kind of increase the circulation to those areas, but then it's just in your blood, right? So the blood is circulating, everything's moving. Your kidneys are working harder then, and then you have to go to the bathroom because all that stuff is now being filtered out of your blood, and your body's trying to get rid of that. So that's also why they say like, make sure you drink plenty of water after a massage. And if you don't, you oftentimes end up sore because you just got all this stuff moved around, and then it resettled somewhere where there's another area of
Hot tip.
constriction. Hot tip.
I never knew
know
that.
any
Pee
of
and
that.
drink water.
I never noticed that I had to pee around a massage either, but
Around a massage?
look, like, after a
just-
massage,
or like
I never
during a
was like,
massage?
holy
Yeah.
shit, I gotta piss.
There's like a
I've never
radius
noticed
around
it,
me.
but-
People are like, oh my god, I need to go to the bathroom.
Well, that'll really mess up the massage, right? To break in the middle of it.
Yeah, I mean, more so for the client. Like, I know where I'm at,
Right.
but like, there's definitely like the first 15 minutes of a massage is usually warming up the muscles and getting someone into the parasympathetic nervous system as opposed to the fight or flight. Parasympathetic being rest and digest. So like, usually 15 to 20 minutes into a session, your client or patient will always go. And you're like, oh, okay, cool. That's where we're at, and that's great. That means you're doing a good job. But, and like, if your stomach growls during a massage, also okay. It's totally fine. That's normal. You're digesting food now, yeah, so that's that.
So you can make people digest food.
Oh, yeah.
Can you make people not digest food?
Yeah, there's a button on their back.
Stop digesting.
Yeah. No, but abdominal
Beep, boop,
massage.
beep, boop.
There's actually abdominal massage. There's techniques to encourage or slow down the digestive tract. So you can encourage people to use the restroom, or if they're going a little too much, you can slow that down for them too.
Interesting.
I peed like literally 10 times a day.
Yeah, we're not talking about pee here.
Oh.
But
Well, now the podcast knows that I pee a lot. But anyways, man, well, thank you for coming on the show.
Thank
Yeah,
you
it was
for
great.
getting
It was
on.
very
I
informative.
don't know about everyone else, but I
interesting.
learned so many things I didn't know before.
Right.
I
Got anything to plug?
yeah.
Follow my SoundCloud at Vanilla Drew.
At what?
Vanilla Drew.
Vanilla Drew, dude.
Vanilla Drew.
Rap
Vanilla
name.
Drew on SoundCloud.
I was just making sure the listeners got that. You said it quick.
I'm not on SoundCloud.
What? You play music
Yeah.
and well.
Yeah, I fully
Well,
believed you.
thank you. That's the first
I've
time
seen it.
anybody's
I've listened to it
complimented
on
my music.
Instagram, and I think you're sick. So
Thank you. Wow. Okay, I'm gonna make a SoundCloud tonight.
yeah. So
Bon, are you making a
follow-
pass at this massage therapist?
Yeah. I need to let you know this is strictly therapeutic.
This is a strictly therapeutic podcast.
This is
but also
strictly for the
continue.
pod.
Yes, thanks for coming on, and remember to share and like and do other stuff that people say on videos.
Tell us
that-
you like us.
Hit
Tell us
that
you
bell.
like us.
Get that notification.
Please.
Yeah. Just drop by and say I like you.
Tell me you love me. I need to hear it.
I love you.
I love you.
I don't want to say it to anyone, but I want to hear it.
Yeah.
All right.
All right.
Well, it's been
Bye, y'all.
fun.
Podcast out.
Peace.
What?
Question.